Thanks very much. There are 16,764 cumulative confirmed cases of coronavirus in Victoria. That's 279 new cases since yesterday's update. I'm saddened to have to report that there have been now 309 deaths due to this global pandemic in our state. That's an increase of 16 since yesterday's report. Of course, our thoughts, prayers and best wishes are with the families of each of those people who have passed away. This will be a particularly difficult time for them. There are, in terms of a breakdown of those fatalities, 1 female and 2 males in their 70s, 2 females and 4 males in their 80s, 4 females and 3 males in their 90s. 11 of those 16 deaths are linked to aged care outbreaks. There are 662 Victorians in hospital. 40 of those are receiving intensive care and 29 of those 40 are on a ventilator. A total of 1,959,302 test results have been received, which is an increase of 21,566 since yesterday. Again, thank you so much to everyone coming forward, getting tested, to the lab technicians, to everyone who's working so hard to give us that critical data so that we can track and trace and limit the spread of this virus. It's such an important thing to do, and I'll come back to regional testing in a moment, but thank you for coming and getting tested, and please, even the most mild symptoms, please come forward and get tested. There's so little flu in our Victorian community this year because of a range of things, not least of which distance, hand hygiene, all of those restrictions and measures we've put in place. If you've got symptoms, cold or flu-like symptoms, there's every chance you've got this virus. And the best and most important thing for you to do is to come forward immediately as soon as those symptoms begin. Don't wait 2 or 3 days. That can be when you are most infectious. Come and get tested. We'll process your result as quickly as we possibly can. There's payments there of $450 if it means that isolating at home waiting for your result would mean you are out of pocket. It's a really powerful and important thing that you can do and you must do if we're all to get to the other side of this. There are 3,478 cases with an unknown source, so mystery cases, 95 since yesterday's report. As I think we're all coming to understand, that's not necessarily linear. It's not from yesterday's data, it's since yesterday, so that coronavirus detective work can take quite some time, but that's our latest addition to those mystery cases. There are 1,164 health workers who are active cases, and we send our best wishes to them. We thank them for their courage and care, their compassion, and we again reconfirm our gratitude to them and our commitment to them to do everything we possibly can to keep them safe. There's a big piece of detailed work being done in relation to a breakdown of health workers, where they've got it, the circumstances. As I've said a few times now, that will be a feature of the early part of next week. So if not tomorrow, then Tuesday, and we'll be able to go through that in more detail. There are 7,671 active cases across the whole state. We've had a few little data issues this morning around an exact number in aged care. As you can appreciate, we've got to not only get the results, but then attribute them to an aged care facility. But my advice, as of literally 10 minutes ago, top level, so not necessarily the exact number, but our experts estimate that there are 2,075 active cases in aged care. In terms of the regional metro split, there are about 451 cases in regional local government areas, those that are under stage 3, and just over 7,000 that are in metropolitan Melbourne under stage 4. Those numbers never quite reconcile because there's always a number of cases that are being investigated. I think the number of cases that are unknown and subject to further investigation is around 185. Just on regional testing, can I just again ask people in Geelong, Bendigo and Ballarat, one of the most important things you can do is to come forward and get tested. There are current sites, we've added to those sites, we've added extra staff. I think some of the opening hours have changed also to try and make it that little bit easier for people to come forward and get tested. We've got 158 active cases in Geelong, 49 active cases in Greater Bendigo, and 27 active cases in Ballarat. That That is stabilising. We did see some growth. I think a couple of days ago we took you through that 14-day picture. It's really, really important that people in those communities, the greater community if you like, so not just the city itself, but some of those smaller communities that look to Ballarat and Bendigo and Geelong, to come forward, get tested. Really, really important. So if there's one ask as a kind of takeaway from today's briefing, if people in those regional cities, and indeed right across the state, but with a specific reference to those 3 regional cities, Greater Geelong, Greater Bendigo and the Ballarat region, if you can come forward and get tested, that is a really important part of us keeping the numbers in regional Victoria, which are low. We want to keep them low and drive them down even further. And I think these last few days have seen us go from about 512, I think was the number. I think that was the peak. And we're now, as I just said a moment ago, we are now down to about 451. So that's a really important thing that regional Victorians, particularly in those 3 big regional centres, can do. That's not to say that people in the Latrobe Valley or the Golden Valley or the northeast or the far west of the state, all of us in regional Victoria, all of those in regional Victoria, if you've got symptoms, please come forward and get tested as soon as those symptoms begin, not 2-3 days later. And we'll do everything we can to get your test processed as fast as possible, and that'll give us the intelligence, that'll give us the information and data that we need. Now, I just wanted to provide a couple of updates on aged care, and then I think we'll go to questions. Japara Goonawara Aged Care Facility, the Joint Command of the Commonwealth-led Aged Care Response Centre, is responsible for overseeing the operational response for aged care where there is a coronavirus outbreak, as you know. Western Health are assisting on site. In fact, I think they are running that site, I believe. That is an important contribution that hospital nurses are making. Again, as I've said a few times now, we've been asked to help, and I'm so grateful to those nurses because they're stepping in and doing that work, which can be extremely challenging and has been. State and Commonwealth teams are assisting in all those different elements: infection control, clinical support, deep cleaning, testing, contact tracing, all that usual list of tasks, but Western Health have management in that particular facility. As at the 15th of August, there are 72 cases that are linked to Japara Goonawara, that outbreak in Sunbury, which includes 43 residents, 24 staff and 5 contacts of those staff. In terms of Dudagala Yarraville, again, the Joint Command is all about overseeing, stepping in, if you like, to make sure that that facility is doing everything that it needs to do and providing the care that it needs to provide. Western Health are also on site there, and a number of residents have been transferred to hospital or to an appropriate health facility, and others are being closely monitored on site. I would just take the opportunity again to make the point that the only consideration when it comes to moving residents or not is their clinical need, their individual circumstances. We've created capacity. It's one of the reasons why elective surgery, other than the most urgent elective surgery, is not happening, so that we've got additional capacity. But at the same time, it's not just about moving entire nursing homes out of a familiar environment into an unfamiliar environment. It's also sending very significant numbers of staff, nurses, and hospital nurses and personal care workers into aged care facilities. Just on Dudagala Yarraville, as at the 16th of August, there are 58 cases linked to that particular site, 33 residents and 25 staff. Just quickly, I wanted to give you an update on disability facilities. That's as at the 15th. Active cases, I explained yesterday, there's some division of responsibility, some that are NDIS run, some that are transitioning to that model, and I think there was one facility that is a state-funded facility. We have set up our own important command and control centre, if you like, a really important initiative on our part. We continued rapid response, I think is the term that we've used to it, a rapid response to disability outbreaks. We continue our discussions with the Commonwealth about how we can all work together most effectively to make sure that we're doing everything we possibly can to support those clients, those residents. I won't go back through that organisational the different way in which the residential and broader disability services system works. I think people have some sense of that. NDIS or transitioning to NDIS, and a smaller number of facilities that remain under state control. But active cases, as at the 15th of August, this is just an update on the numbers I'd given you a couple of days ago. Total active cases, 81. That's a decrease of 8 since yesterday. 27 of those are in transfer services, 53 in NDIS services, 1 in state-funded care. Total staff cases, 61. 24 in transfer, 36 in NDIS, 1 in state-funded. Total resident cases, 20, of which 3 are in transfer, 17 in NDIS and none in state-funded. Total sites, 53, of which 17 are transfer, 35 are NDIS proper as we speak, and as I said, 1 is state-funded. This is a significant challenge for us, but I want every staff member, every resident, every family that's connected to these settings to understand that whether it be the rapid response that we've set up as a state government and the ongoing discussions we have with the Commonwealth about, in many respects, mirroring the aged care approach from a central command and control point of view, we are well aware of the risks and challenges here, and we are well and truly committed to doing everything we can to keep your loved ones, to keep you safe. That, I think, probably sums up the updates that I needed to provide, other than just to thank Victorians for the tremendous job that the vast majority are doing. These numbers are heading in the right direction. They speak to a strategy that is working. At the same time, though, no one day necessarily guarantees the outcome. That is a long, hard slog. This is an endurance race. It's not a sprint in any way. And whilst these numbers are positive, I wouldn't want anyone in any place in Victoria to think that we had the luxury of kind of backing off, if you like. We've just got to stay the course on this, and I'm confident Victorians are equal to that challenge, and they will, in increasing numbers, follow the rules to make it much more likely that we can get to the other side of this quickly, and that we can then begin the process of not just opening up, but the process of rebuilding. I think we're happy to take any questions you have. All three of us.
Can we start on the state of emergency being extended?
Yeah, sorry, I should also mention that the state of emergency has been extended until Sunday the 13th of September. That is in line with the approach we've taken to this point. That obviously facilitates the important operation of elements of the Public Health and Wellbeing Act. The state of disaster also works over the top of that. So between both of those frameworks, that means that there is no doubt as to the authority and the effectiveness of all the different measures that we've put in place, none of which we take any joy from having to impose, but they are critically important. And as you can see from these numbers, although it is only early signs, and we do know that there's that lag effect, where today you kind of only see the early influence of our shift from stage 3 to stage 4, but these are encouraging numbers. And as I've said many times, we are a strong state. Victorians are incredibly resilient. We face enormous challenges each and every year. 2020 is in some ways unique, but I think that we've got to stay apart, yes, but at the same time we have to be completely united in getting to the other side of this, and that's why so many people are working so hard, including every single Victorian who's following the rules. I congratulate you, I thank you, and I encourage you to keep doing that.
In terms of where the numbers have been sitting and going, are you more confident that we will be able to ease restrictions at the end of the 6-week period?
Alex, I think it's too early for us to be able to provide a definitive picture, but what I would say is if you do a trend over the last 7 to 10 days, then we've gone from around that period, maybe just a little bit earlier, 700 plus cases. We're now certainly not in that territory. That's what the data says to us. Might we be tomorrow? We'll just have to wait and see what tomorrow's numbers are. So I'm always very cautious, but there is on my part at least, there is a cautious optimism and a sense of real hope that this strategy is working and that we are seeing numbers fall. Now, the key point here though is, it's perfectly appropriate for us to look at these numbers and say, right, the numbers are coming down, that's what we want to see happen. But none of us can in any way become complacent or think that, okay, well now the law just automatically kick in. You've got structures, you've got rules that kind of work at a macro level, but ultimately those rules are only as good as the many millions of individual choices and decisions that individuals and families make every single day. So not breaking those rules, not going out, not being out after curfew, not ignoring symptoms and waiting 2 or 3 days and then maybe getting a test or maybe not. All of those really personal choices, that's what makes the rules work, that's what makes the strategy work.
Sorry, I was just about
Sure.
to ask on the aged care facilities in
Yes.
Sunbury in Yarraville. How many hospital staff have been seconded to those facilities?
I probably need to come back to you with an exact number, but there'll be teams gone in there, and it'll depend on how many residents are there, Samaya, but I'm more than happy to come back on that.
Can you also come back to us with a rate or a proportion of the number of healthcare workers who have been either furloughed, seconded?
I think, yeah, so what that piece of work that I referred to must be 4 or 5 days ago. I think at that point I said that it'd be early next week, so tomorrow, Tuesday. What that's aiming to do is to answer some of those fundamental questions. Okay, so we know how many health workers are positive. Where did they get it from? Do they get it from work? Do they get it in the community? As well as, I think, if we can, some further breakdown. So the term health worker obviously covers nurses, personal care attendants, public hospital, private aged care, as well as I think it may even include some other workers in that team, so not necessarily clinical staff. So I think part of that breakdown is really important. So my last advice was that's coming along well, and we should be able to have that to you, if not tomorrow, then Tuesday. But safe to say, as soon as we possibly can. It is a big piece of work. We won't get every answer with that. There'll always be some cases where, yes, the person was working in a clinical environment. So you might say, okay, that's probably where the greatest risk was. That's where, even with the best of PPE, that's where the infection must have come from. But when you've got as much of this out in the community as we've got, then it can be, and we've got plenty of evidence to show that there's been cases that have, even though you work in a clinical environment, you didn't you didn't get it in that clinical environment. Then there's issues about, so patients to staff, staff to staff, staff and family. There's all manner of different data analysis that needs to be done there, and that's what the team's been working on. So as soon as we can get you that, we will.
Just on aged care.
Sorry, Laurel, yes.
Had two fresh heat outbreaks, I guess, and Dudagala, I guess, is the most recent one. Given that the state and federal governments are now working together with this control centre, apparently all staff have got PPE, everybody's been trained in infection control procedures.
Yep.
How are we still having this situation which is out of control?
Well, I think the important point to note here, and there's work done every day to try and assess, reassess, confirm, double, triple check every single day that there's no breakdown in any of those protocols and procedures. But in many respects, this is a direct function of the fact that this is a wildly infectious virus, and it just doesn't take much for one person to give it to another. And it is, as I've said to you many times, it's a wicked enemy. But I wouldn't want anyone to think that as we see cases in different places, we don't go and try and analyse what might have caused that. That's the whole point of this, that continuous improvement. That's why there's literally an enormous amount of work that goes on to try and trace back, well, where did it come from? How did it get in there? Is there something? Is it a systemic issue? Is there something we can do to improve that? That is a constant process. And I think every day there's probably changes that are made. Sometimes very small, very, very small things, but all of them add up hopefully to, and certainly today, yes, there are some additional outbreaks, but there are certainly less than we had 2-3 weeks ago when we were at a real tipping point. And I think that the partnership approach, where you've got all the most senior people in that aged care structure working together, regardless of who pays them, regardless of what government they work for, they're all working together, motivated to do the very best. I certainly can't rule out that there will be other outbreaks in other aged care homes. but we're all in there working as hard as we can, not only to respond to each outbreak, but I suppose, Laurel, the best way to answer it is to learn from each outbreak. Is there something that we can change, even a small thing, because that can sometimes be the difference between this virus spreading. But it is such a wicked enemy. It's so infectious and moves so fast.
We get to the stage still now, all these weeks down the track, where we've got a nursing home going, help, we don't know what to do, we can't control it ourselves, we need help.
Well, look, again, I'm not here today to run a commentary on aged care. I don't want to get into those sort of areas, because that just becomes what might be seen as an argument between different governments.
Learning quickly enough from our mistakes.
I think everyone's trying as hard as we possibly can. We've been asked to go in and help, and we're doing that as best we possibly can. Those nurses and PCAs and others who don't normally work in aged care, and they certainly don't work in private sector aged care, but they're stepping up, and we're incredibly grateful to them. I'm confident that there is that continuous process of trying to get better, to learn. Every outbreak, every case isn't just something you have to respond to, but you're obliged to try and improve because of it. And circumstances do change. I think many of these homes have unique factors, just as every resident has their own story and their own complex needs and all of those important things. As I've said to you, I suppose I'll take you back to some broader commentary that we've run along the way. Like, even when this second wave is over, we will still see cases. We will still see outbreaks. That's just a function of this thing. Like the notion of completely extinguishing it and never seeing it again, I think that would be an unlikely outcome.
When you analyse those outbreaks,
Yeah, sorry, Samaya.
Sorry, when you analyse those outbreaks to see, what can be improved, what were some of the lax measures, is there an overarching theme or a common denominator between the aged care facilities that we're still seeing?
I'm happy to have a longer discussion on another day about that. I haven't got that in front of me now. But look, you look at it this way. You've got adequate supplies of PPE. You've got health professionals who are, so motivated and so concerned for their patients, as well as, of course, for the welfare of their colleagues and themselves. And still, even with all of that PPE at that high grade, we're still seeing cases. So what that shows you is that nothing we do can eliminate risk completely. And in some respects, the more vulnerable the cohort, the more that point will be exposed. Nothing you do can ever take that risk down to zero, but it's about trying to mitigate it, trying to manage it. But again, I suppose in terms of learnings, that big workforce piece that we're doing that I referred to before, I think that's a prime example, not just of reporting numbers, but trying to understand what sits behind them and then trying to be guided in what you might do differently. I don't know that we will do much differently out of that, but it could be that shows us some very minor thing we could do that might make a difference.
Is there any evidence that there is, even though it's been minimised, the moving of staff between these facilities, is there any evidence that the latest outbreaks are actually because of there is minimal numbers of staff?
I can't speak to that, but I'm more than happy to try and get an answer for you. We certainly have worked very closely with the Commonwealth and with private sector providers to try and drive down that amount of movement. We're certainly doing that in our system also, even though we've got just a fraction of the cases, but as a kind of preventative measure. Let me come back to you. If there's data to give you, then I'm more than happy to do that. But it is critically important that we have across this industry and every industry. If you've got symptoms, if you feel sick, then you just can't come to work. And logic tells us, and that's why we've worked so hard to try and limit the amount of movement of staff between different places of work. And we know that does create some added pressure. But we are all very, very focused on that issue. But if there's something I can add to that, then I'm happy to do it, Alex.
Can you give us a bit more?
On one of the new outbreaks at Hambleton House in Albert Park, the
Yes.
manager there said the DHHS footed the bill for private security guards and that didn't work. Do you know if that would be accurate, and is that why the police are there now?
Well, I know the police are there. I can't speak to the background of that, but I'm happy to follow it up for you. I've had a very quick briefing on that issue. I'll get into that a bit more later on today, but there's a range of clients and residents there that have particularly complex needs, and it's appropriate that we respond to those in this context, just as we do every day. It is a It is an SRS setting, but the best thing I can do there is try and come back to you when I've got some further details. As I said, I've got very much a top-line briefing on that particular facility, but I'm happy to chase it up for you.
Should we still be using private security guards though for
Well,
situations like
I'm
that?
not certain that I'm not sure in what circumstances staff have been deployed there. Let me follow that up for you.
Premier,
We're going to go here, yes.
yeah, you talked about the pressures on aged care staff in particular. Do we have enough in the state? Is there scope? I know some of the advocates are saying we're still running short, we're still under pressure, we need more help from interstate. Is that something that you're considering?
Oh, well, we've got some support that's come from other states, and if we need further support, then I'll be the first one to ask for it. That's been a feature of our response across the board, and we're very grateful to other states, to the Commonwealth, to all sorts of agencies, and indeed, where appropriate, we're very grateful to the private sector who have stepped in and given us staff. Sometimes it's been a really good outcome on the basis that some people were effectively stood down. They didn't have any work to do, and we've been able to use their often specialist skills to get this job done. We've got additional teams arriving, I think, from South Australia, maybe some from West Australia, but again, we've got people arriving all the time to play different roles. Again, this is an opportunity for us to thank those nurses, those many hundreds and hundreds of nurses from hospitals who've gone into these very challenging environments, and they're doing a great job in really tough circumstances. But that puts some strain on them, because it is, some of these places are in absolute crisis, and that's a really challenging thing for even the most experienced nurses to have to deal with. That's why, it's a small amount of money in the scheme of things, a couple of $100,000, but we've upped the counselling and support services for those nurses, because some of the things they're having to deal with are particularly challenging, and they're not the sorts of things that they have to deal with in their public sector work, in the work they do every day, or their nursing work. But that's where we find ourselves, and you've got to look to take care of the people who take care of us.
Back on Hambleton House, yesterday
Yes.
we heard that a number of COVID positive residents and also close contacts had been out in the community. Can you maybe walk us through what the process is in isolating either close contacts or positive cases in such difficult, who live in?
No, I can't on that particular facility, and the best thing for me, because they're all different, what I would do though is I'm happy to commit to try and come back to you with some further details on that.
Maybe this is something that you need to get back to us on as well, but DHHS yesterday said they were considering moving some of the COVID positive patients.
And that will be appropriate for some people. I want to be very careful about how I might express this, because we are talking about vulnerable people with often very complex needs. That's why that's their home. I would just say that sometimes the facility will lend itself to people being able to isolate. Sometimes it just won't. A bit like the shared bathroom issue with aged care. Sometimes the challenging nature of the behaviour and some of the issues that those clients deal with on a very personal level, that'll be more conducive to isolation than others. We try at all times to make sure that they are receiving an appropriate response, but one that is mindful that their dignity is very important, just as public health is. That's a balance, and I think we get that balance right. But there are occasions and circumstances where an alternative accommodation offering is the most appropriate thing for the client, for public health, for the people they would normally live with or alongside. Let me come back to you with some more detail on that.
Appropriate accommodation, do you mean in a hospital setting or like hotel quarantine?
Well, it would without wanting to kind of de facto describe all those clients. Sometimes a mental health facility might be appropriate. Sometimes other supported residential services might be appropriate. Sometimes non-clinical housing, so whether a hotel, something like that, might be appropriate. It's as varied as the needs of those clients, which is very much varied. So let me come back on that specific, and I think that might give you an example that can help to understand the system more broadly.
Just on disability, why hasn't you spoke about the state's rapid response, why hasn't there been a similar system to aged care set up in disability?
I actually, at one point, Laurel, thought that had been a decision that was made, but we're still talking with the Commonwealth about that. I'm hopeful that we can get to a point where, just as we have stood up, I think, a really good system, we've been asked to help, we're doing everything we've been asked to do. Everyone, the most senior people, are sitting around the same table every day, every night, trying to have that in real time, acute focus on what's happening. I think my view is that would serve us well in disability services as well. I think that matter is just something we're going back and forth with the Commonwealth on, but we'll get there.
Is there resistance from the Commonwealth?
I can't speak for the Commonwealth. You'd have to speak to them. I think Minister Robert would be the person to talk to there, I think.
Just on the rapid response, I asked a number of weeks ago if something like that had been set up for the disability sector, and you said there had been. So how long has this rapid response control centre for the disability sector been?
I don't have an exact date, Samaya. You may well recall with greater accuracy than me when you asked me that question, but I'm happy to follow it up. And look, what I'm really saying to you is I think that as good as that is, a state-established rapid response centre, I think the better way to go would be to have have a governance framework, have a system that is exactly the same as private sector aged care. And that's, I think, what we're talking to the Commonwealth about.
So just to clarify, we've had a rapid response.
We have had a rapid response.
But now the Commonwealth is involved.
No, but I want them to be, and that's what we're talking to them about.
In terms of the jobs, originally it was 250,000 will be impacted. Do you have an update on the numbers of that, or is it
Not beyond what I think the Treasurer spoke to this week, but we will have both modelling, and I think the Secretary of the Department of Treasury and Finance went to some of this as well. I've got no update on that. Some of this, like all modelling, you've got to assume certain things. There's no getting around the fact that there's a really significant amount of economic pain that comes from these important decisions. If there was another way, then of course we would choose another way. But you don't get these sorts of numbers, and even if you take one day out of it, you don't get a trend that has the numbers coming down unless you take really quite drastic action. And I apologise for the pain that causes, but I've got no choice but to follow advice, and I've got no choice but to make the tough calls, and that's where we find ourselves. Would I know be easier if I could predict with some certainty when this will end, if I could give people a date, give people a number that we think we're going to get down to? That's not the nature of this thing. It's a deeply frustrating, wicked enemy, and it'll only be beaten if we have a greater resolve than it does. We've got to stay the course, and that's exactly what we're going to do. And then there'll be hopefully a period that is stable, and that allows not only more economic activity, but a really exclusive focus on jobs and strength, skills, and really get building and repairing so much of the damage that this global pandemic has done to us.
in terms of specific workplaces, abattoirs? There's obviously been some concerns with abattoirs ways with the government. Can you fill us in a little bit more on whether there is major concerns that employers actually, through possibly negligent action, have fueled
Sure.
this on it?
I saw those reports today. I've got no list of companies to go through with you, and that's not because I don't want to. I don't have a list of companies. There'll be WorkSafe out there doing inspections. That's an important part of their job, and there will be from time to time. There will be some in this industry, in many different industries, whose compliance with their COVID safe plan is not up to scratch, whose practices may not be conducive with stopping the spread of the virus. That's done at arm's length from us, and I think that's the way that it should be. We've always known that abattoirs, meat processing in a broader sense, is a high-risk environment. I think Brett was yesterday talking about meatworks in Germany, for instance, where they've had 1,500 cases in the one place. So it's a high-risk environment. In general terms, though, I would say that as challenging as these restrictions are, so going down to about 2/3 for red meat, 80% for poultry, some other special arrangements for smaller abattoirs, smaller seafood businesses, that's been really tough and really challenging. But in the main, my advice is that businesses large and small, whilst they're not happy to be in those circumstances, they're working as hard as they can on PPE, on shifts not crossing over, on physical distancing in the lunchroom, all of that sort of stuff, testing. I've only got positive reports, but again, that's something that we monitor business by business, day by day. That may change, but I'm not saying the reporting's wrong. It didn't quite align with my most recent briefings.
And in terms of farming and borders, obviously
Yep.
The federal government said it was up to the premiers to sort out, and you said you were going to ring.
I've had several conversations with Gladys, and I hope to be able to report progress on that quite soon. and I hope positive progress.
Will there be some kind of state?
And just to be clear, on the New South Wales Victoria issue, I can't. The request I think is a broader one that relates particularly to New South Wales and Queensland, and I can't speak for that.
So we can foresee that there'll be a positive outcome in terms of New South Wales.
That's what I'm working towards, and that's what Gladys and I have talked about on a number of occasions, and I'm very grateful to her for that. And while I'm at it, and I say I'm very grateful to her for the other support that they've been providing to us, together with other First Minister colleagues. It's not unlike bushfires every summer. We all pitch in, we all help out each other, because a problem in one jurisdiction is ultimately a problem for all of us.
Have you attempted on the South Australian border, or is that?
No, I haven't yet. All I'd say is Jack Symes, as the Ag and Regional Development Minister, has had lead responsibility for all these cross-border issues, so I'm certain that she would have been speaking with her counterparts in South Australia. She certainly has been, I know, been speaking with her counterparts in New South Wales, and I suppose to a certain extent there'll be some impacts of Tassie being closed too. So that's a work in progress. There's literally been hundreds of different issues raised, everything from health workers to freight to all sorts of different stuff. And there's a team working on that. Our cross-border commissioner's working on that too. But I hope to be able to provide you with a positive update quite soon in relation to the issues that DJ and the VFF raised around a permit system, particularly for farm workers, farm machinery, different products that are inputs to that whole ag cycle. Hopefully I can give you that update soon.
Before you said that you were not hopeful, on Thursday you said you weren't hopeful about a permit, a specialised agricultural permit. Are you?
No, I think it was interpreted that I wasn't hopeful about that. That wasn't what I said. I don't believe that isn't what I meant. What I think tried to give the impression that the notion that like completely free movement, I think that's probably unlikely because the border's closed for good reasons. We don't want this spreading. We don't want to see others having to deal with the challenges that we're dealing with. But I'm actually quite hopeful that we'll get a positive outcome there. And if I could announce it right now, I would, but there's a little bit more work to be done.
Just on the state of emergency, it seems now would be in nearly 6 months of state of emergency.
Close to, yes.
Do you have any idea of how long it's been since Victoria's been in 6 months of state of emergency, and are there any ramifications that come from that? Do you need to go back to Parliament, for instance?
Yeah, look, there's some interplay with, so 6 months is the maximum under the Public Health and Wellbeing Act, but there's a bit of interplay with the state of disaster, which kind of sits above that. I think the Solicitor General is turning her mind to those issues and has provided some advice and will continue to do that. On your question about whether we've ever been... Well, these arrangements reflect the Royal Commission and the work that was done out of bushfires in the main. It's a different structure. But outside wartime, I don't think that we would have had a similar set of arrangements in place for this long. And if we have, I think they would be a less relevant comparison, given that this isn't going to end anytime soon. That the notion of having structures, rules, that kind of COVID normal, rather than returning to something that would be just like an ordinary year. It's ordinary, all right, but 2020 is throwing a lot of challenges at all of us, and that's why I'm so proud that Victorians are, yes, staying apart, but are sticking together as well. It makes you really proud. This is a tough year, and we're going to get through this, all of us, because we are a strong people, and we look out for each other, and we know that we are all in this together.
In late March, one of the other things you introduced was a 6-month moratorium on rental evictions. That's
yes.
to expire late next month. Will you extend that moratorium?
And I will have further announcements about those matters to make in due course, and when I do, I will be armed with all the facts and details, and I'll be able to take your questions on that day. And I'll have a minister with responsibility for that standing beside me as well. We know that the arrangements may expire, but the need continues, and we'll make sure that we've got further things that we can do to support people in those circumstances. I think it's been very important. It was one of the most important decisions, I suppose, out of National Cabinet, that we would deal with some of those challenges. Times are tough enough without people having a sense that they might lose their home, or indeed might be forced to continue an as normal tenancy arrangement for a business, for instance, where there's nothing like normal turnover.
So likely to be extended?
Well, as I said, Samaya, I'll have further announcements to make about that, but I think you can read into my comments that I understand the need, and we're always about trying to meet those needs. So we'll have more to say at the appropriate time. As you noted, I think it's still a few weeks away before it comes to an end. There's only so much I can brief you on any given day.
On all of us being together, we've seen an incident overnight where a police officer had to discharge a firearm in a confrontation with someone who was out of curfew hours looking to buy cigarettes, and we've also got reports of people driving to the other, 40 k's to try and get better surf from police today. I mean, where do we sit in compliance in your mind?
Look, I think that there are a growing percentage of Victorians who are doing the right thing. There will always be examples of people who make really selfish and appalling choices. That's what Victoria Police are out there to deal with, and believe me, they will deal with you. I want to take this opportunity, and quite frankly, whether it's popular or not, I want to take this opportunity right now to thank every member of Victoria Police for the work that they're doing. This is very challenging, and this has been a very, very difficult year for Victoria Police, a very difficult year. And I send my thanks to every police member, and I send my thanks to every police family across our state. They're doing a mighty job, and I'm very, very proud of them.
Are you able to comment on that incident?
I wouldn't comment on an individual incident like that, not unless I'd been briefed specifically on it, but I'm sure police media would be happy to follow that up for you.
Question, Professor Sutton. Oh.
Certainly.
I believe the release yesterday said that there was a fresh outbreak at Frankston Hospital. Do you have further information on that?
I may have some further information on that. Certainly, we're aware of cases linked to Frankston Hospital. Again, as we've said, for all healthcare worker infections, it's not always clear how they've been acquired, but it's a stress, obviously, for those who are involved, and there's furloughing or quarantine for their close contacts that are obviously often other healthcare workers as well as their families. I'm not sure if I've got specific numbers for today. Minister, do you have anything? We can come back to you.
Can I pick up on one of Premier Andrews?
Oh, we're back.
No. To you. No. Just about around compliance. We know, you would know more than any of us around here, that punitive measures are generally not conducive to public health messaging. Can you walk us through what your advice was to the government on not only the hefty fines, but a couple of weeks ago, subsequent, infringements now cost about $5,000?
I didn't really go to Cabinet on issues of compliance. I think it's really for the relevant ministers and for Cabinet in general to make determinations around the nitty-gritty of how compliance is best met. My advice was really on the public health principles, that we needed to have a very significant reduction in the interaction of people. How you practically bring that into being are matters of communications and engagement, compliance and enforcement that are for the relevant ministers and secretaries of those departments, really.
As a public health expert, though, what do you think about the enforcements that are in place, the hefty fines, and also the shaming? Like every day from Victoria Police, we get a few lists of, what some people were doing, how they were breaking curfew. What do you think about that approach that we have to?
Look, I think we need a mix, obviously. I would always, as a public health physician, say that we need to put awareness raising and communication engagement at the heart of our approach, and I think it's worked. But there will always be a need for compliance and enforcement for people who are willfully flouting those rules. I don't think the police intend to shame anyone in bringing to bear and illustrating those instances of non-compliance. I think they are shot across the bow, if you like, for anyone else who's thinking of also being willfully ignorant of those rules, because people continue to do that, and so I think it does need to be called out when those instances of non-compliance do occur. I think it's overwhelmingly the case that people are doing the right thing. Speaking to the flu season, if you look at April to August, we've had a 300-fold reduction in our flu cases for that season. don't take it from the beginning of the year when restrictions weren't in place, but for April to August in Australia, 300-fold reduction in flu transmission is extraordinary. It's never happened in the world. At the beginning of the year, we were getting the Northern Hemisphere cases. We still had people travelling into Australia, but with the end of international travel, effectively, and all of the measures that we've had in place from March onwards, that's shown that you can stop a really infectious virus from transmitting in the community. And so these measures that we've got in place and all of the awareness raising that we've got around that are doing the same thing for coronavirus. But it's actually more infectious than flu. It's clearly more deadly, 10 or more times more deadly than flu. But we've saved hundreds of lives from flu this season because of the actions that we've taken for coronavirus. So it's really important that we've got both the rules, but also, real positive encouragement for people to do the right thing.
And just on that, has either the Department of Health and Human Services or one of the institutions like Doherty or Burnett Institute, for example, conducted formal social and behavioural research during the COVID pandemic?
There's the Behavioural Insights group within Department of Premier and Cabinet. They've done quite a bit of work, but I know that there are lots of academic institutions, including at the Doherty, but in particular at Burnett Institute and elsewhere, who are looking into those particular behavioural lessons, if you like, about what people struggle with, what motivates them, and the kind of messaging and the modes that will help in that regard. And they're feeding into DPC's behavioural insights in that regard, but they're also providing that advice directly to me that I share with our comms folk.
We did have some warmer weather yesterday and saw some pictures of some people out, probably not social distancing. How concerned are you that when we do eventually get to the other side of stage 4, that people will just relax completely and get complacent again?
It is a concern that people will give up on all of this. I hope it doesn't happen. I think there are some things that are clearly now embedded in our psyche. The fact that we've got masks, people carry on wearing their masks as they're sitting in their car driving home. These are the things that we're going to start to embed behaviourally in our lives. I think the fact that we kind of have a radar around us for that 1.5 metres, that will continue. But yeah, it's absolutely a concern that there are some aspects here that people are struggling with, and we need to be really careful about how we move back and how we reinforce the requirement to live in a COVID normal world.
Can you elaborate on that just a little? Because the Premier indicated that effectively extinguishing this is not possible, but we're hoping for a state of stability for those business owners out there who are shut down at the moment. Do you have any idea what that would look like for them, what their rules are going to have to be in place to try and keep it that way?
Not clearly. I mean, I think the lesson from around the world is that we're watching this with new lessons every single week, every single month. There are countries that have had this under wraps for many, many months through testing and tracing, who are now struggling with increased numbers. South Korea's had 167 cases in a day. They were used to 4 or 5. There'll be new challenges arising as we move through this, and we need to be agile in responding to them. The critical elements will that there'll need to be some baseline behavioural change for everyone across the board, for businesses across the board, the way that they implement systemic changes to mitigate that risk, and for every single individual to change the way that they go about their interactions for others. That'll be the core to this. But in terms of how we can manage very small numbers of cases and or whether it's feasible to drive that down to 0 is all to be determined.
Just on community transmission, we've still got nearly 100 cases. Obviously, we're nearly 2 weeks into full lockdown now. How worrying is that? Because if people are obeying stage 4 restrictions, you'd have to start thinking maybe they're getting it going to the supermarket or places like that.
It doesn't disappear with a week or 2 weeks of really significant restrictions. Spain had kids not able to leave home for 6 weeks. They had people exercising only within 150 metres of their home. They still had months of ongoing transmission, so it doesn't turn off overnight. We know that some of these will be generations of ongoing infections within families. Because it's not easy to isolate within your own home. It's not easy to isolate in extended families who are all co-located. We're providing support to people who need it to quarantine outside of those settings, but not everyone does that. So we are going to see further generations of transmission but the trend is good, and we are seeing a reduction. The effective reproduction number calculated today looks to be at 0.86. It was at 0.97 when I last spoke to it, and that's also a reflection of the numbers that we're seeing now, which was transmission 10 days or more ago. So it'll improve. We are getting there, but it's because we're doing the right thing, but it's not just going to turn off overnight.
The Federal Health Minister has said today he's as optimistic as he has been to date about the development of a vaccine. What's your understanding of where things are at now and your message to Victorians about what we can expect?
Yeah, certainly, the work on vaccines is a huge collaborative global effort, more than 200 in development, dozens that have gone through the phase 1 where they're testing it to see if it might have effect. The phase 2 trials where it's tested on healthy individuals to see if people are developing an immune response, and there are a number that have gone into phase 2 and now phase 3 trials, including large-scale phase 3 trials where they're testing that vaccine to see if in the real world people going out being exposed in their tens of thousands are protected, and we'll get a picture of that level of protection in the next couple of months. So that's very encouraging. How effective it'll be, how long-lasting that immunity will be with the vaccines is part of what we're looking into now. But the fact that there are vaccines in phase 3 development that will really come up with their results in the next month or two is very encouraging. And we know that there's production that's happening at the same time as these phase 3 trials are occurring. So, those pharmaceutical companies are actually betting on making millions, if not hundreds of millions of doses, without actually knowing if it's going to be a vaccine that they can use. But we know that if there's a successful vaccine, we'll want those billions of doses to be able to go straight away. So it's a big risk in lots of ways, but it's really important that we have these parallel processes so that we can have a vaccine go from the first day that it's given approval.
At PAEC last week, you said vaccine would probably be in the next 12 to 18 months. Is that still?
Look, I said I thought it was unlikely within the next 6 months. I hope that it's not 12 to 18 months, but we have to prepare ourselves for the long haul if there isn't a vaccine available earlier than that. If something comes out of the gates and is available in Australia and can be produced at scale, of course, I'd be delighted to see it, and I'm sure the federal government will be putting its hand up to have that manufacturing or procurement available here.
I was hoping to take you back to my questions about the social and behavioural research. Can you maybe tell us what that research has identified and found? And how the Department of Premier and Cabinet has responded to those findings?
There are lots of complexities with the behavioural insight stuff. I think a lot of it relates to the fact that positive messaging can be quite motivating, that people need bespoke messaging, that there are literally hundreds of separate cohorts within populations that need a tailored approach for messaging to have that behavioural engagement, and that we need to be really broad and creative around the modes and the methods and the media and content that we use. It's not one size fits all by any means, and so the multicultural work that's being done at the moment, that's really being stood up with those issues in mind, I think is to address all of those findings.
You mentioned infections within families. Is there any evidence of secondary infections that you're aware of at this point?
Secondary infections like pneumonia on top of coronavirus?
I'm sorry, I apologise. Like people that have maybe brought it into their home, they've recovered, a family member's gotten ill with COVID-19 and then they've passed it back to them?
No, not aware of anyone getting a repeated infection with coronavirus. It does seem to provide a natural immunity that protects people, at least for 3 months, probably longer. The CDC has said they're satisfied that there's good natural immunity for people who've been infected within the last 3 months. It's probably longer than that.
There is reports that the New Zealand cases may be linked. They're investigating a link to Melbourne. Can you update us on that?
So obviously we've got cases in a site that is also Americold, but there is no evidence that there's been any freight movement at all to New Zealand from that location. There'll be work to look at the genetics of all of Australia's cases and sharing that with New Zealand so that they can get a better understanding of whether there's any link whatsoever to anything that's circulating in Australia. But in terms of an epidemiological link to Melbourne, none whatsoever established at the moment.
To that end, can I just make a point? I've had a couple of conversations with Prime Minister Ardern and with the Chief, with the New Zealand High Commissioner, and we remain providing any and all support that they need around some of that data. But as Brett said, no link established, but the labs are talking. We're doing everything we possibly can to be as helpful as we possibly can.
So does that mean genomic testing as well?
I think there's all the data we've got, regardless of the method, all the labs are talking, not just for Victoria's cases, but of course the reference laboratory that deals with the makeup of the virus as it's presented right the way around Australia, that's located here in Melbourne. So we become a portal, if you like, for all the cases, all the different strains, and we're doing everything we possibly can to help them out. It hasn't provided an answer to this point, which I know will be very frustrating for them, but the very best of minds are continuing to work as hard as we can to support our friends in New Zealand.
I was hoping to ask Professor Sutton.
You absolutely can.
I'm sorry.
That's fine. You haven't got anything else for me?
Can I just ask
I
about...
do, but at the end.
At the end.
Oh. That's not gonna be
Bit of build up there. It's all good.
Brett,
Brett,
can I just
it's
ask
back to you.
Sorry, can we just clarify on the New Zealand thing? You said there's absolutely no link. So it's definitely ruled out, or it hasn't been found yet?
No, I've heard that the operator of Americold in Melbourne has said definitively that no freight has gone to New Zealand.
I just wanted to ask about the infection control measures at the Department of Health and Human Services. We know that process has been at times pretty lax. How have you improved or how has the department improved their infection control, particularly over the last 4 months?
With respect to what, Samaya? I'm not sure.
Just in terms of, whether it's at aged care facilities, hospital settings, hotel quarantine, how have you improved?
Well, we've obviously had guidance that's been available online and with an expert reference infection prevention and control consultant available in the department. We provide those general principles to all industries, to all departments where it's relevant, but they need to come up with their bespoke infection prevention and control advice and go out to their own experts, as industries, as sectors, as workplaces to manage that. But our outbreak squads have been available and going out to aged care, to disability services, to a whole bunch of outbreak settings to respond immediately, but also to look at infection prevention and control issues wherever they find them, and to provide on the day and on the spot training, but also to follow up to make sure that those procedures are strengthened. But they've also actually visited hundreds and hundreds of settings in advance of any outbreaks or any cases to look at their plans and procedures in place, again to go through a review process and to address gaps as they've seen them.
Premier, one question that I've received quite a number of times during this presser is, it's a hard one. Where is your North Face jacket? Is it in the wash?
Well, you've got to try and be as rotational as you can be.
Premier, can you
It's my son's 18th birthday today. I thought I'd put a jacket on. I'm sure he appreciates that. I have many different jackets. And I really wish, can I say to every one of the how many hundreds of thousands of people are watching this right now, if only what I wore here every day was the most important issue. I long for that day. It may never come, but until then, we're just going to keep pushing forward. We're just going to keep fighting this wicked enemy, and we're going to beat it, because Victorians are amazing people, and I'm very proud of them. I'm really very, very proud of them. Not just today, but every day. And my sense of it, and the data I think is confirming that more and more Victorians are joining the fight against this and doing the right thing. And that's the only way that we'll drive these numbers down.
Just on learnings from aged
Jacket or no jacket.
Just on learnings from aged care, how have we, or how is the government assisting in terms of improving the communication with families?
Yes, now on that issue, Mark, I sent a message to the Prime Minister this morning, and I may well speak to him later today, or I'll have some further text back and forth. But he and I have talked about this a couple of weeks ago, that it is a real challenge. We've done our very best to try and have many of our staff, our hospital nurses who've been asked to go in, they've gone in, they're trying to do that job, but also be as attentive to the other needs of those residents. So I think I used the example yesterday, literally taking tablets, iPads to people's bedside to help facilitate Zoom calls, taking phones to people, all of those things. It's not unexpected that there's some challenges here. There's a lot of clerical staff that have been furloughed. Patient care becomes the absolute number one issue. But I did send the PM a message this morning, and we'll probably keep talking about that. Anything we can do, of course we will, because I know it's a deeply distressing and challenging time for families. And that's why, I made some points the other day about we've all just got to be really careful that we're not feeding any sense of anxiety amongst families who've just got no cause to be anxious. We're doing everything we can. I know there are some families out there, they read reports and they think, well, maybe this is an issue for my loved one. There's no coronavirus in the home where their loved one lives. In fact, they're nowhere near it. But getting information to people quickly, I can appreciate that's really something that families need, and we're all committed to getting that done. And as I said, I had a communication with the Prime Minister about that this morning. Just said, look, I'll push from my side. You do the same. Let's see if we can get that even better.
And just on anxiety, we know that the ADF was used at Epping Gardens when they were intervening there. Are they assisting in any of the intervention? Do you know how many homes have ADF staff?
I don't have an exact number, but I think the way to view it is that they essentially support all of these actions because they're there and can be used at a moment's notice. There's some specialist teams within the ADF that support us in some of that work. They don't always go in. Sometimes that'll be deemed appropriate. Sometimes it won't. But if you rather than the uniform people, where if you just look at state and Commonwealth, everybody's working together as closely as they possibly can with that fundamental focus, that absolute focus on the health, well-being, welfare of every single one of those residents, and by extension, which is why some of these communication challenges are a real concern to me and I know to the PM, by extension, the welfare and safety and security and peace of mind for families, that's a really big part of our focus too.
Do you mind if we ask the Health Minister about
Absolutely.
testing regionally?
She's waiting there to answer a question. Very good.
Minister, a lot was made of the testing blitz, particularly regionally. Can you just walk us through how many tests we've seen in Bendigo, Ballarat and Geelong, and whether that's providing us with any data that could drive decisions for stage 4 or otherwise?
Okay. So firstly, we have been concerned by the increasing numbers of cases in regional Victoria, particularly in those regional locations. This is why we've been stressing to residents in those communities that if they do have any mild symptoms, they should present for testing. The numbers, thankfully, are looking like they are slightly stabilising in recent days, but there's no room for complacency. We still encourage residents in Geelong, Ballarat and Bendigo in particular, but right across regional Victoria to present for testing if they have mild symptoms at all. In terms of the specific data, anecdotally, I've heard that there has been an increase in individuals presenting for testing, but we'll come back to you with some specific numbers because the numbers are still being collated for the last 24 hours in terms of providing those regional breakdowns. So we'll get that to you later today.
The 27 cases in Ballarat, that's not a very high figure. Is there any particular reason why you're so concerned about that area?
Sorry, the number of positive cases?
Active cases
Yeah.
in Ballarat, I think it's about 27.
Yeah, because we've had in Geelong, Bendigo, other locations, we've had cases associated with specific outbreaks. Obviously, they're ones that are then able to be contained and managed. Ballarat, we're still exploring the reasons for those cases. So obviously we are concerned in all locations where it appears there's a degree of community transmission. This is why we're encouraging regional Victorians to not be complacent by virtue of the fact that they are in a different setting to Melbourne. We're also wanting to stress to regional Victorians that they should avoid travelling to Melbourne if that can be avoided, because the last thing we want to see is people travelling into Melbourne then taking it back to their family and to their community. Can I just also add one further thing in relation to Hamilton House that was asked earlier? I think it was your question, Samaya. The advice that I have is that 10 residents have already been relocated from Hamilton House and the rest are being relocated tomorrow. They are being transferred to dedicated services at Alfred Health. Are also working with St Vincent's Hospital and St John of God in Berwick. So they will be supported in that accommodation. Obviously, some are positive, some are negative, and we're concerned about the welfare of those individuals. As the Premier explained, these are individuals with some challenging behaviour. This is a private supported residential service, but we are working to support both the facility and also, most importantly, the residents at that facility at the moment.
How many have tested positive?
I'm not sure if I've got that specific number on me, but we can come back to you. It was, I recall...
the manager says it's a dozen.
Yeah, that's my recollection. I think it might actually be a little bit more than that, was the most recent figures I saw this morning, but we can come back to you with the specific numbers.
And when you say Alfred Health Services, what does that mean? Because obviously these people who are negative don't need to be in the hospital. Will they be all taken to hospitals, or what sort of settings are you talking about?
There's unique units that these hospitals have to support people with mental health and other challenging behaviour, so they'll be supported to stay there at least for a number of weeks. It may be a couple of weeks before it's safe for them to transfer back to their home.
And these 10 residents who've been relocated, are they all have they all tested positive to COVID, or are some close contacts?
I'll have to come back to you, Samaya, with that information. I don't have the specifics of the numbers, but I understand that some of them are positive and some are negative.
Is that new St Vincent's on the Park facility being used at all for these aged care residents?
Not for these particular ones. That facility provides us with 84 additional beds. If we need to utilise them, we will. They are ready to go. They're fitted out. They've got staff. It's a fabulous facility that's had a massive revamp, and it just really adds to our capacity to respond to any additional needs. So, I'm grateful for the work that all of our health services are doing at this time, and particularly want to thank all our dedicated healthcare professionals. They're doing amazing work, and I too want to lend my thanks, as the Premier did, to those nurses in particular who have stepped in and are supporting private aged care facilities right across Melbourne at this present time. We could not do that without them, and I'm very grateful to them for the work that they're doing.
I'm sure it might be a bit of a relief given the scale of the job that you've got, but can you clarify your involvement in hotel quarantine going forward now that there's been that shift to Jill Hennessy's portfolio?
Okay, so firstly, the way I guess press reports have characterised it in recent days is not accurate. I think a lot more will become very apparent as the inquiry unfolds. Essentially, we've moved from a multi-agency response to one department now running the hotel quarantine program. So the Premier announced back on the 27th of June that there would be a reset and that Corrections Victoria would be running that program. And in fact, the powers under the Public Health and Wellbeing Act that go to the powers of detention have had to move across to the Department of Justice, and that happened on the 8th of July. So that actually happened quite some time ago, and it's been something that I've been very supportive of because it means that one department can now deal with all of the roles and responsibilities that goes with running that program, from being the contract provider to engaging the staff and all the other services. And of course it's meant that those powers that were the subject of that gazettal notice needed to move across the Department of Justice, and they go to things like making sure that they can legally detain people in a hotel, making sure that they are able to exercise welfare checks as is required under the legislation every 24 hours, and making sure that authorised officers have the legal power to issue people with those detention notices. So it's a very legal thing that needed to, I guess, tidy up so some of those technical issues around legal powers under the legislation that took place, but that occurred on the 8th of July, and it's something that the Premier has flagged many weeks ago that that was on the cards.
Minister, will you be going to Parliament on Tuesday?
Yes, I have considered the advice issued by the Chief Health Officer in relation to the advice he's issued to the Legislative Council. I think the advice is clear. It's different to the advice that existed for the last sitting week. The advice is clear, and it's my intention to be part of that sitting.
So how has the advice changed?
So the advice is specific to regional MPs are discouraged from attending based on our concerns about, as I said, for all regional Victorians travelling into Melbourne and then potentially taking the virus back to their local communities. So the Chief Health Officer's advice is discouraging of regional MPs from presenting, and as for the rest of us, and including myself as a Melbourne-based MP, taking all the precautions necessary through physical distancing and all the advice that we've given to all workplaces to make sure that we can keep ourselves safe. Obviously, it's still important that in the chamber that there's a minimal number of people present. As we know from all workplaces, having lots of people in close proximity to each other does present a risk, regardless of whether you're an MP or you work in a factory or you work in any other workplace.
Does this mean that you'll be answering questions in the chamber this time opposed to taking them?
I'm very much looking forward to doing that.
Premier.
Last question.
Sorry, Premier, as a lower house MP, now that Professor Sutton's advice to the Legislative Council has changed and he allows Metro MPs to sit, albeit in, a self-distanced measure, would the Legislative Assembly also sit or consider sitting one day next week?
I have no advice on the sitting of the Legislative Assembly. We will not be sitting until further notice. And I think the Speaker is looking at a whole range of different options around virtual sitting, things of that nature. Look, again, I'm not interested in having a quarrel with the Legislative Council, but we're not going to be doing anything at all that might contribute to the spread of this virus. The Legislative Assembly is twice the size, in fact more than that, than the Legislative Council. We've all got a lot to get on with. Parliament's of course important, we know that, but we've all got to be very much focused on getting things done and driving these numbers down, and that's exactly what we are focused on.
Professor Sutton, would your advice apply to the Legislative Council as well as the Legislative Assembly?
It's applied to the
And I've just made it very clear to you what the Legislative Assembly is doing. That's a matter for the Speaker. It's a matter that I think is very well understood. Well, that's not at the top of my list, and getting these numbers down is at the top of my list, and none of us doing anything to contribute to the spread of this virus. Today is a very sad day for some Victorian families, but in broader terms, today is a very important point where yet again we're seeing.
Can't you delegate to him to do that?
Sorry?
So you can keep doing what you're doing, but then couldn't you put it to Colin Brooks to take on the new advice and possibly?
No, the Speaker is an officer of the Parliament. The Speaker's not delegated anything by me. The Speaker is an officer of the Parliament, and as it should be. He takes his responsibilities not just to members of Parliament, but to hundreds and hundreds of staff very, very seriously. That's a really important part of his job. If you want to talk more about those matters, it might strike you as strange, but I've spent very little time thinking about that matter. We'll get the Parliament back when it is safe to do so, and there'll be lots of time for the usual things that happen at Parliament when the announcements are made. Not by me, but by the Speaker, I would think.
Minister, can I just ask you a question about voluntary euthanasia? Voluntary euthanasia?
Oh, okay, yes.
There is some suggestion that people, due to not being able to access a carriage service like a phone or an iPad, are having issues accessing voluntary euthanasia during the lockdown. Have you had that concern raised with you at all?
So the legislation relating to the voluntary assisted dying scheme requires regular reporting to the Parliament. There is a report due to be presented to the Parliament very soon that will be able to present the latest data and will be able to give us some greater insights from the board itself, who do the review of all of the cases, as to how that legislation has been operating in recent months. Look, I have flagged previously my concerns about the Commonwealth Criminal Code and how it intersects with our scheme in terms of the inability of telehealth consultations to occur. We certainly don't want any of our clinicians taking any risks, and this is why my department issued very clear advice when the scheme started in the middle of last year. So, look, I had heard concerns some time ago about these issues. I haven't heard those concerns reiterated more recently, but I think once we see the latest data that will be presented by the review board soon, that will give us some additional insights as to how the scheme has been operating. Look, I just want to say, just in terms of the criminal code, I have written to Commonwealth counterparts about these issues. It would certainly put a lot of people's minds at ease in terms of doctors wanting to assist their patients through telehealth appointments if that legislation was to be changed, or if some clear advice was issued by the Commonwealth Government to just make sure that no one felt that they would be putting themselves at risk legally if they were to assist a patient through a telehealth appointment. I do think it's inherently unfair for regional Victorians to have any additional barriers there that don't exist for those of us who live in metropolitan locations. So certainly it is my wish that the Commonwealth would be able to provide that clear advice to doctors, medical practitioners who want to assist their patients in Victoria. So it's an issue I've taken up with them. It hasn't been...
Since you did last time, have you
Yes.
done it again, or are we just referring to the time when it was first raised?
I've raised the issue a few times and some time ago. I haven't seen any movement on the issue, but I think once we see the more recent data that'll be presented through the review board's imminent report, that'll give us perhaps some additional insights as to whether this remains an issue of concern. Of course, it would be good just to put the issue to bed once and for all if we had that clear advice given to medical practitioners that the way the criminal code that was drafted some time way before our legislation passed the Parliament was never intended to create a barrier to medical practitioners wanting to use telehealth to provide support under our VAD legislation. Anything else?
Any other issues? If not, just again, the message of the day in many respects is, particularly those in Bendigo, Ballarat and Geelong, if you've got any symptoms, as soon as you develop those symptoms, please come forward and get tested. Arguably, it's the most important thing that you can do. Beyond that, congratulations to every single Victorian who is following the rules. That's a growing number. We are all very proud of you. That's exactly how we will get to the other side of this. If there's no other questions, I will see you tomorrow.